Hey, good afternoon, everyone. Can you all hear me?
Yes.
Yep, we
There
can
we
hear
go. Some sign of life.
you.
Well, I just want to give it another minute or two. It looks like we already have over 100 folks in. Just going to give it another minute or two. And just want to thank everyone for taking the time on the afternoon. I know it was a little bit short notice, but we collectively wanted to ensure that we get this on the books as soon as possible. I think there's obviously a lot of concern and some misinformation going around. So I thought this would be a good opportunity for DBHDS to give an update on the reorganization, and for community members to hear directly and offer any questions and feedback, and just really use this as the start of the dialogue. And so, like I said, I'll give it another minute or two. Just in the meantime, Megan or Heather, I didn't know if you guys had anything you wanted to present, or if you just wanted to talk. Just let us know. We can make you the host if that's the case.
Are you able to hear us if we talk? Oh,
Yeah, yeah.
okay,
We can
that's
hear
great. Hi.
you. Hey, how's it
Um,
going?
Good. For those of you who don't know me, my name is Meghan McGuire. I'm the Deputy Commissioner for Policy and Public Affairs. But while we're waiting for others to join, I first wanted to thank you all for your interest in this. I love that there's over 100 people on such short notice. It sure speaks to how important this issue is. And we're grateful that you would all take the time to discuss this with us. And I also really want to thank Victor for his leadership, for organizing this, and bringing folks together to talk about this. And of course, Heather Orrock too, from Vocal. So I just wanted to start with the thank yous as we're going forward, and just let you all know that we're really looking forward to the discussion.
I don't think anybody else can join because it's capped at 100. And so that's kind of, we got on the screen who we have.
Yeah, I think we will give it another minute or two. We'll try on our back end to see if we can change that limit. Thought we had a higher limit. But thank you, Megan. If we just give one more minute, and then we can get started. We'll just check on the back end if we can change it. If not, this will be recorded, and so it will be posted right afterwards. So folks who are unable to join will still be able to view the content of this video. Okay, well, that was quick. It looks like we can't, unfortunately, we cannot change the limit on it. So I think we will go ahead and get started. Megan, how do you want to kick it off? Do you want to just anybody else on your team want to do introductions?
Yeah, I think with me, and then again, for those, if anybody else joined, I'm Meghan McGuire with DBHDS, and am glad to be talking with you all today and for this time. But I wanted to also pass it over to my colleague, Heather Norton, as she has really been thinking about innovative ways to move forward in the department. I will say that with this, we are currently challenged to be thinking out of the box, thinking things differently, thinking about how we can be a little bit more efficient. And while I don't know that people will see a lot of the internal things that we're doing, we hope that it'll come out in the back end or the front end as higher quality services and extending our reach to be able to just provide higher quality services to the people in the community. So we're excited about that. And we know that it's going to take a lot of input from the community and how we can incorporate this and implement this as we move forward. So again, Heather has so many of these thoughts and details, and I will pass it right over to her.
And hey, Heather, right before you start, just quick housekeeping, folks. I think, and it's so many of us, in order to really, I think, promptly get through this and get as much information as possible, we'll allow Megan and Heather to, go through their presentations and, really get in as deep as they're able to, and really try to hold the questions for the end. You feel free if you want to drop them in the chat so you don't forget. At the end of it, I do believe where we would be able to kind of pull those questions for folks that didn't get answered and kind of send them over to Megan and Heather from there. But just ask, please don't jump in so we can hear the fullness of the information. All right. Thank you so much, Heather. I'll pass it on to you.
Thank you, Victor. As Megan said, my name's Heather Norton. I am the Deputy Commissioner of Community Services at the Department of Behavioral Health and Developmental Services. I want to thank everybody who's joining today. As you've heard, we are in the process of a reorganization. The goal of this reorganization is really to ensure a coordinated and comprehensive behavioral health care where peers are embedded and valued throughout the continuum from prevention to recovery. This expands the role of the adult community behavioral health to include and provide support to all providers of services across the continuum, not just our community service boards. And this recognizes that the road to recovery is as unique as each person who pursues this path. What we are trying to accomplish is to leverage the skills and talents of all of our staff to elevate the voice of peers by having peers at the table for all conversations and the continued development and implementation of DBHDS priorities, including the full activation and implementation of STEP Virginia, which is based on SAMHSA's best practice related to CCBHC, to ensure that as the state behavioral health authority that we are working with all providers and organizations that support people with serious mental illness and substance use disorder, to align our work, all of our work from all of our office under our one agency strategic plan. And also to ensure that the work that we're doing is outcome driven, specifically focused on best practices, as well as expectations from the General Assembly, our funders, and others who are really looking to us to be able to describe what it is we're doing, what it's resulting in, and how it's improving the lives of Virginians. It also will work to create back-end efficiencies within the department and to ensure that more money is going towards services and supports for people, as well as consolidating our administrative work in terms of duplication of efforts that will be minimized by really bringing all of the programs together under one umbrella. This restructure ensures that we are embedding peer knowledge, skills, and abilities throughout the continuum, and that it is the first thing that is being considered as we look at developing new services, new programs, or new ways of doing business. And then ultimately leveraging all of our staff in the division to elevate the role of the peer to ensure that we have a movement related to peer services, because as a single office, it really has a small staff, and this will help elevate that with all of our staff in terms of the work that we're trying to accomplish. And so that is the primary thing that I wanted to communicate with everybody. And Cheryl, I see your comment, and I understand that it's not just peer services, that it is the entire concept of recovery, and that there are different pathways for all people. And I do want to make sure that we take care of that, acknowledge that, and really work to make sure that that's integrated for all individuals, from prevention to recovery for all the people that we're supporting.
Okay, thank you so much, Heather. And I didn't want to jump in too soon. Did that sort of complete your
Yes.
prepared remarks? Awesome. Okay. Well, from there, I know there's also some frustration. We haven't quite been able to get everyone in on this meeting, and maybe we can talk offline about maybe a part two at a later date, so that more folks are able to chime in with that. So some of the questions that we've heard are, and I'll just go off is, well, how will this impact sort of the day-to-day communication that organizations and individuals may have with the Office of Recovery Services? How will that change with this new restructure?
Truthfully, I don't anticipate that really changing much at all. Really, we will be working with our staff and our teams to operationalize this so it has minimal impact on the community. That is ultimately our goal. The restructure is really for internal stuff, but it is not to diminish the work that the team has been doing. It is really to revisit that and to figure out how we can utilize all of our resources to make sure we're delivering all of the services in the best way possible and making sure that we can leverage the skills and talents of the entire team to support the recovery staff and all that they're trying to accomplish.
Thank you so much. It looks like Becky, you have a couple comments in here. Did you want to ask a question? Did you want to ask your question, Becky?
My, can you hear me?
We can.
Okay, so my question is, one, you've got a powerful group of advocates saying we don't agree with this decision. I hear what Heather is saying and believe that her goals, as stated, can be met through the existing structure. It's interesting that the structure has changed from when I was director, directly under the commissioner, to now we're 5 layers deep. I don't believe that that allows for a strong and powerful representation of the recovery voice. And in fact, I see it as a pattern of minimizing that voice as time marches on. So the question is, how realistic is it that DBHDS will listen to their constituencies and even consider reversing this decision?
I think that we are restructuring for a reason and a purpose. And I think that, as I've indicated, it is actually to elevate the voice of peer services across the continuum of care. And I really believe that what we're doing is going to demonstrate that and make that voice more powerful and more included in all of the things that we're doing. And I look forward, to hearing from all of you if you see that what we're doing is not working, backsliding, or is somehow undermining that effort, because that is what we will all be working towards at the department, is really to lift up the voice and to include it in that coordinated and comprehensive behavioral health care that I've talked about.
If I could add to that, first of all, hi, Becky. It is great to see you. I
Hi.
miss you still. I loved working with you, and I hope you're having so much fun.
Active retirement.
Oh, I cannot wait. Someday we'll get there. But DBHDS has, you all know this. I mean, it's just an enormous mission. We're trying to accomplish so much and meet a great demand. You all feel that too. And this organization has 6,000 people. We're the largest, or third largest agency in the state. And one of our many historical problems that we have are things just live in these silos, these stovepipes. And we've really been trying to address that. We've really been trying to figure out how we can integrate these voices in the same way that we found out that integration is the way to go when it comes to services in the community. So when things are in those stovepipes, offices just tend to operate independently, and there isn't as much coordination together. And as we're kind of looking at some of these divisions, and this is not the first reorganization that we've done here in the past several years. This is maybe the third or fourth. We completely redid our entire facility services division. We're looking at some other reorganizations. We changed crisis services. I mean, there's been a lot of different changes to try to make our operation more efficient. And as we start looking into things and peeling back the layers of the onions, we see all kinds of duplications, all kinds of other inefficiencies that make it really difficult to get the job done effectively. So, I fully agree and support what Heather's saying about we need to elevate the voice of recovery. But we also need to operate in a way that is efficient too, and be able to serve you all. And I just don't think that you'll see some of those things, but I hope you feel it. I think I mentioned that earlier. And I hope that helps kind of explain some of the other reasons too, and that these things work together, if that helps at all. But it should be a long process. I think one thing Heather and I have talked about is it would be so helpful to have a work group put together, so that we can continuously talk about how these things are being implemented as we go forward. And I hope that we can look at it with, I'm thankful to work for an organization that is willing to do things differently and is willing to innovate and try different things when things aren't maybe working as well as they could, and see if we can't integrate those services better. Oh, Victor, you're on mute, I think.
Okay, no, I was saying thank you. As you can imagine, we have a lot of comments and questions, and we have quite a few people here. And so I'm just thinking about the most efficient way to, get to the core of what some folks are asking without duplicating the same questions. Um, what I'm seeing in the comments, and maybe you can speak to this a little bit, is that there's a lot of concern that there wasn't the proper voices of individuals in recovery at the table to kind of speak to how this move may impact at the sort of at the ground level. Wonder if either you or Heather can kind of touch on how that voice will continually be integrated and at the forefront.
Yes, thank you, Victor. I think, what Megan was talking about and what we will be doing related to this is really working both with our staff and with our community partners as we operationalize this restructure, in terms of what it's going to look like as we continue to move forward in terms of the work that we're doing and how that is going to be. And so I know that the new organizational chart is confusing in that I wanted to make sure that people could see that prevention, recovery, and treatment were all still a part of that it isn't meant to be three offices, if you will, under behavioral health and under substance use. It was just to say that we are acknowledging that we're looking at all of those things as a part of those areas, and not, increasing silos or decreasing collaboration across those offices, because I did see a comment in there that do we think that people are one thing or another? Absolutely not. I think that the ultimate goal is to serve is to serve people regardless of their diagnosis. And some of the programs, as they're being pointed out, that were not yet integrated into the overall restructure is because of the complexity that's related to them. It's not because we don't believe that all of the work that we're doing needs to be integrated. And I would go so far as to say even individuals with developmental disabilities who have co-occurring substance use and serious mental illness also need to be incorporated into that continuum of care as well. And so, you know, this is one step in a continuum of evolution for DBHDS in terms of really serving people based on their individualized needs. And so, you know, I think that this is just the first iteration of this process that will take additional time and work through that.
Thank you. Casey, I think you had a really good question here. Do you want to unmute and ask yourself, or would you like me to read it?
Yeah, I can ask. It just, I know you're speaking to the fact that this is just a representation and you wanted to show that there is the prevention, the treatment, etc. But it does look like this is like mental health lives here, substance abuse lives here, or substance use disorders live here, and we have such, and housing is over here. There's so many of those things that overlap. I would argue they all overlap. And with so many of the populations that we serve, how do you intend to make sure, excuse me, within this organizational structure that you've proposed, that it isn't going to end up siloed? If you have the group that falls under this branch really focused on this and the group under this branch really focused on this, how do they work together?
So I think that part of that is really to increase the collaboration across those. So instead of having to collaborate across 4, 5, 6, 7 offices, we're now collaborating across 2 and integrating the work. You know, ultimately, I think we'll be looking at projects and programs and different things like that that don't necessarily fall up under a disability type. I mean, ultimately, like I said, that is the goal, is to serve people regardless of primary, secondary, tertiary diagnoses, right? It is really to get people connected to the right supports and services at the right time, depending on what they need. And so hoping and we'll work towards, so it won't be hope, it will be through great effort to make sure that there is no wrong door for a person who's seeking services, regardless of diagnosis and how they receive supports and services.
Thank you. It looks like Lauren had a question that a lot of folks had similar. I mean, excuse me, Laura Robertson, do you want to unmute and ask your question?
Sure. So I just wrote in the chat, I just think it would be helpful for us to have more of an understanding about how this decision was made. So like what data sets or indicators were reviewed, what analysis was done that showed that a reorganization was necessary, who conducted the analysis, and then what were those specific findings. And I think if we get some answers around that, that will offer some more clarity. Thank you.
So I'll give a partial answer to that, and that's certainly something that we can put together some additional information on. You know, as I said, one of the primary focuses, if you will, related to this is really to get to the best practices, to meet the expectations from our General Assembly, our funders. There was, you know, I spent about 8 months looking at all of the things that we were doing within the Department of Adult Community Behavioral Health, the way that they were being operationalized. And so some of that, you know, resulted in just as an example, where we were pursuing the purchase of 6 or 7 different learning management systems, where we initiated similar contracts 7 different times across 5 offices. And all of that in terms of how are we utilizing our money to support individuals and the services that they're receiving, and how could we work to improve supports and services for individual. These are all things, these are part of the data that went into that. There was also looking at best practices through SAMHSA, through other data in terms of integrated care models and different things like that. So, there's a lot of different things that went into this determination, and gathering information about what the offices are doing, and then of course really getting to outcome-based data for the individuals that we're supporting.
Thank you. Tina Pollard, do you want to ask your question?
Hi, yeah, I was just wondering like what this would look like on the ground if people in the Office of Recovery Services would be disseminated out, like into some of these other programs, or if they'll physically remain there in Richmond. I mean, are they going to go out to be voices on treatment teams and voices in CSBs and things like that, or are they going to remain like a work group up in Richmond?
Ultimately, part of the idea of this restructure is to leverage all of the staff so that we can be providing those supports, consultation, and technical assistance across the Commonwealth to all the individuals that need that support. And we can't do it with the few that are in each of the different offices. So bringing those resources together, having them to be a concerted voice together, can then be able to go ahead and to provide more assistance in the community.
Victor, may you ask my question, please? This is Gail.
Victor, you're on mute still. Did you ask Gail to ask her question herself, or did you want to read it?
Oh, this is Kate. Victor's computer not allowing him to unmute, so I'm gonna go ahead and see. Gail, I am trying to scroll. Gail, would you mind re-asking it in the chat?
Oh, I can read it if you like.
That would be great too.
Okay. So I said, thank you first for the 10 years of the Office of Recovery Services. I think I read that somewhere earlier. And also that this team has done such a great work in uniting peers across Virginia. How is that work going to continue on a ground level?
Through all of the amazing things that they have and will continue to do. I believe that they're going to continue to do amazing things, and I believe that all of these things are going to continue to continue to happen. We will be working with them to identify what we do next, what we maintain that we've always done in terms of conference certification, and the different things like that. We're not looking to dismantle what has been built. We are looking to elevate what has occurred and continue to enhance that through what we're doing.
Thank you. I'm not sure what happened on my end, but thank you, Gail, for reading your question there. Um, and I agree. I think ORS over the last 10 years has done, a phenomenal job. Here at SAARA, we've worked very closely, and I think, collectively we've gotten some great outcomes. So, certainly kudos to the work that has been done, and would love to see that type of work continue. There's a question here for Catherine, which is touching a little bit on youth support partners and family support partners. Catherine, do you mind reading that out? Maybe she dropped. Well, the question is, what does this look like for youth support partners and family support partners in the state? We are peer supporters, so not sure how this would work. Youth support work with individuals who are not adults. Um, you have any sort of response to that?
I think that, we're going to continue our work with our family support partners with the youth support program that we're developing right now. That's part of the budget that just came through. Our teams are working in collaboration across the Office of Child and Family Services, and we'll continue to work with our team experts in recovery services, and continue to, make sure that those services are delivered and implemented well.
Thank you. And there's a follow-up asking about the PRS workforce, and particularly how will going forward, just training for peers, workout, certification, things along those lines.
I'm sorry, Victor, they're drilling in the conference room behind me, so I didn't catch the end of that.
Oh, no worries. Just if you can, essentially, it was just asking, can you touch on how things will work now for peers when it comes to trainings? I think the conference coming up, and really the peer workforce around certification, stuff like that.
So if I may be frank, this information always was intended to be shared publicly and to be shared with our partners in the community. However, it got shared before we got to finish doing some of the internal work around some of the questions that that everybody here is asking. And so I'm gonna, indicate that we don't have the answers to all of the questions at this particular moment in time. That really was intended to happen with the team's input over the next week and a half. And so, I'm happy to receive all of the questions and continue to follow up, work with you all, provide additional information as it becomes available, and go, until we've resolved all of the questions. At this point, no, I don't believe the conference will be canceled in August. I had no intention. We never had any intention of doing that. It was really, around getting our priorities in order, maximizing the utilization of our staff, preparing for, any uncertainty to make sure that we could leverage all the staff that we had in the ways that we needed to, and to really focus our efforts on the DBHDS priorities for the Commonwealth.
Understood. There's a question here from Sarah Scarborough. Do you want to jump in and ask that in regards to enhancing what RRS does around funding and staffing?
Sure. Thanks, Victor, and thanks for having this opportunity. Was just wondering about how the enhancements will happen, and hoping that there's additional funding in order to just expand the work that has already been done with ORS, which we've been really pleased with, and then kind of a timeline for the additional things that you all are planning on doing and changes that you're going to make, considering it's kind of nearing the end of the administration.
So we will be working, I'm going to answer a couple of questions, Sarah, while I answer your question about when I talk about the team, I'm talking about the staff from Adult Community Behavioral Health, which includes the Office of Recovery Services, the Office of Prevention Services, our team who is responsible for the implementation of STEP Virginia, and then, of course, the office that focuses on substance use, housing, and then our Office of Child and Family Services. So we're talking about the work that we're doing with all of them, and, you know, we're working to gather that information, operationalize the work that we're doing, and then putting together the plan that will kind of lay out all of the things that are going to happen over the next 6 months for us to get this fully functional and working through that. So I imagine that we will have a plan by July 1 that will take us till October 1 to fully execute. And then we'll, you know, of course, be gathering additional information on, you know, how we're doing, where we could do differently or better, or what else needs to happen.
Can you please give some specific examples on how closing ORS is making its voice more elevated?
So the goal is to ensure that our persons with lived experiences voices are embedded throughout the continuum of care, that they're at the table for every discussion from beginning to end, and to really make sure that they're involved in our priority setting and the work that we're doing right from the beginning, and to make sure that we don't have competing priorities that are occurring that might diminish the work that they're doing.
Thank you, Heather. There's been a few comments in here really addressing individuals with co-occurring diagnosis, and maybe a little confusion about, you know, which office, how does that integrate? Can you touch on that a little bit?
I think that you know, our goal is to develop processes around that, and to make that collaboration more seamless across the offices related to the supports and services that individuals will receive. That we will have staff embedded in both sets of offices who have existing working relationships with the teams that they were previously affiliated with, which will make that integration more seamless because those relationships and collaborations are already established. So we'll help to facilitate that and really break down the barriers that individuals might exist in terms of receiving those supports and services.
All right, thank you. David had a couple questions about some of the initiatives that have come out of the ORS office, and it sounds like there's still to be discussion on how those will transfer over, but some that are pointed out are things like the Recovery Blast, the VAPRS portal. Is there a conversation to continue those much needed resources and others?
Sorry, yes. We're working on all of that. Again, our intention is not to necessarily discontinue anything. At this time, we want to work with the team and really make sure that we have all of the right supports available for individuals.
Thank you. And James Swisher had a question. Are there any anticipated cuts to DBHDS? Now, we all have been aware of what's been happening federally with the cuts to the ARPA dollars and SAMHSA, which, for those who don't know, helped fund a lot of the initiatives over the last 4 or 5 years related to this office and others. What, are you at liberty to talk to us about those changes and those cuts, how that will impact DBHDS going forward? And are we anticipating any additional cuts?
I'll tell you what I know, which is not a lot at this particular moment in time. Do we anticipate potential additional cuts? Yes. I watch the news too. And so I think that part of this is also positioning us in the event that there are changes so that we can continue the work that we're doing. And so, that's what we're trying to accomplish.
Thank you. And looking at time, obviously, we were not going to be able to cover every question during this limited time, but this is just the start of the dialogue. And I just want to recapture 2 things I heard that I think are really helpful to understand as we're going forward. So as of July 1, this transition will start taking place, but not expected to sort of be fully transitioned until October 1st. Is that what I heard?
I think the entire plan will not be fully operational until October 1st in terms of, working with the team, recognizing that some roles and responsibilities may shift based on as we're starting to operationalize this. And I think that some of those things will take time. And that's more so around internal stuff in terms of contract management and different things like that, and who's responsible for what in terms of the work that happens here at DBHDS. And so I think that some of that is going to take a little time to build all of that out. But as Meghan mentioned, we will provide a lot of information, and I appreciate and respect the frustration and the distrust that's being felt when we don't know a lot. And it's unfortunate that we didn't have an opportunity to get some of this additional stuff together for you, but we also did not want to not meet with you since information has been out there and, be forthright. I just want to be, share what I know, what we're working on, where we're going, how we will, continue to communicate and share information, which is our ultimate goal.
Well,
And
yeah, no, I appreciate that. Once again, I know this is very short notice. And the information, just to be frank, coming out has caught a lot of people just off guard. And it sounds like it wasn't the intention to have it released that way, which is why there's still a lot of information that is sort of in the gray area. But I do think some of the comments here today show that, there's a need for maybe more involvement from the recovery community in whatever direction moves forward. But there's a lot of value that the ORS office has brought over the last few years. And I think there's a real need to keep, in essence, the work that has been going on, keeping it going. So what are ways that, just a community of people online and beyond can share more of their comments and their feedbacks and get some of their questions answered to, help shape a better path forward?
I will jump on that one. I think, you know, there's several things that we are interested in doing. We would love to start some sort of a work group, as I mentioned before, so that we can be able to talk with you all about these changes in a more real-time basis. We also would be happy to set up either an email or, you know, designate a person that you can send your questions to. I'm going to need to check on who the right person would be for that, and then I can send it to Victor, if you're willing, and be able to send that out to the group. We're happy to continue to take the questions from you all. I mean, it informs us as we move forward with the implementation here. And there may be some other ways as we put our heads together to think of ways that we can communicate with you all and help you inform us as we go forward. So thank you for that question, Victor. I think that was very helpful.
Yeah, you know, we will be happy to share that information and, you know, point people in the right direction. And would love just maybe another opportunity in the coming weeks to
Sure.
have, you know, another discussion, just a little bit more time for folks to get a handle of the situation and to be pointed with their questions and allow for more folks. So we can talk about that offline
Yeah, that's great.
communication off. And as we're sort of approaching time, I don't know, Megan, either you or Heather, if you have any sort of last parting words. If not, we will find a way to download these questions and get those out.
That would be great. The questions would be great. And, you know, just like we started this call, again, thank you for your interest and taking the time and for getting together on short notice. It's always, you know, finding that path between informing early and, you know, you don't want to keep things from folks. I'm grateful that we had this opportunity to sort of level set with what we know. And that it helps keep everything front of mind so that we can make sure that we continue to get information that's helpful to you. And we'll keep moving forward with that. So thank you. This was helpful to me personally, so I'm grateful for that.
All right. Well, thank you. We will, as soon as we get done and download this, we'll upload this to share so folks can share it out. And we will be in touch with next round of conversations and sort of where to go forward from there.
Perfect.
All right. Thank you all.